Okay, this video is going to go over Chapter 22, the respiratory system. Objective 3, forces that allow air movement into and out of the lungs. So in your handouts that you got from the bookstore, you should have a handout like this. There's also a worksheet that goes along with this video. So here's the link to the website over here. And then here is the key to the worksheet. There is a handout, like I said, so I encourage you all to take a look at this video just to understand a little bit better visually how all this works and how it's all put together. I'm going to check this animation right here. I'm not sure it works. It's McGraw-Hill, so sometimes those are kind of iffy there, but I do encourage you all, and it looks like it is working just fine. So I do encourage you all to take a look at this animation as well, just so you can understand visually how inspiration and expiration work. So let's kind of talk about pressure. Pressure works basically like diffusion as far as things move from an area of high concentration to an area of low concentration. Well, when we're talking about pressure, gases move from an area of high pressure naturally to an area of low pressure. So we're going to use 1 atmosphere of pressure or 760 millimeters of mercury to represent normal atmospheric pressure. Just like when you're dealing with a length and you're looking at inches or miles or kilometers, pressure is measured in millimeters of mercury or atmospheres. There's a couple of other units you can use. So if you see those, normal is 1 atmosphere. That's what atmospheric pressure will be at sea level. So when the intrapulmonary pressure, which is the pressure inside the lungs, is equal to the atmospheric pressure, 1 atmosphere, the atmospheric pressure at sea level is not going to change. It's the pressure inside the lungs that's going to change, okay? But when those two pressures, the inside of the lungs and the outside of the lungs, when that pressure is equal, notice what happens. No air moves. Because why? Gases move from an area of high to low pressure. If you don't have a difference in pressure, air can't move. So gases can only enter the lungs when the pressure inside the lungs is lower than atmospheric pressure. So if atmospheric pressure is 1 and your lungs are less than that, then air can move in. So we have here this pressure inside the lungs, and if that is less than 1, because we know the atmospheric pressure is always going to be 1. So this is out here is always going to be 1 atmosphere of pressure. So inside the lungs, if this is less than 1 atmosphere, then we're going to get movement into the lungs if our pressure is lower inside. Now, what are the muscles that are involved in respiration? You should have remembered some of these from A&P1 when we talked about the muscle system. So you've got your external intercostals. Now, keep in mind, this right here is a rib. Okay, so intercostals means muscles between the ribs. So these are 2 ribs right here. And these are your external intercostals. Notice they're going one direction. You've got internal intercostals going a different direction. You've got some innermost intercostals even going another direction. Bottom line, your intercostal muscles are involved in contracting and relaxing to allow the expansion of that rib cage. Another important muscle involved in respiration is the diaphragm, and you all are very familiar with that. I know maybe in your mind you had it envisioned as like a straight line that went straight across. It actually looks more like a parachute. It's kind of curved upward a little bit, and it is making contact with the base of the lungs. So just a little information about pressure and volume. You can watch the video if you want some more information on Boyle's Law. It's just kind of a cute little short animation, but you need to, this is what you have to know. This is your big takeaway. Pressure and volume are going to do the opposite things. So if pressure increases, the volume will decrease. As the pressure decreases, the volume will increase. So that's the relationship. You just need to know that pressure and volume have an inverse relationship. One does one thing, one does the other. And if you need to understand visually how that works, you can take a look at this video, okay? So let's talk about inspiration. And what I've done here is I've taken clips, little images from that Armando Hasudigan video. So it follows that just to kind of help visualize, because he does a fantastic job doing the artistry here and explaining what's going on. So inspiration is when you're going to inhale, when air is going to enter into the lungs. So what things are going to happen during that in order for you to inspire? The contraction of the diaphragm and the intercostal muscles. So the diaphragm has to contract. Notice this arrow right here. When the diaphragm contracts, it's going to pull down. When the intercostal muscles contract, it's going to expand the volume inside the lungs. So the volume inside the lungs is going to increase when you have the diaphragm and the intercostal muscles contracting. Remember the relationship. If volume increases, that means pressure is going to do the opposite. Pressure is going to decrease. So what that means is the pressure is lower inside the lungs due to this expansion, and outside the lungs, we now have a higher pressure. Keep in mind, we still have 1 atmosphere. So the outside pressure hasn't changed. It's still 1 atmosphere. But because the volume of the lungs has changed, the pressure inside the lungs has dropped from 760 millimeters of mercury to 759 millimeters of mercury. So it's only dropped 1 millimeter of mercury, but that is enough for gas to go from that area of high pressure to low pressure. Even if it's just a change of 1 millimeter of mercury. This is going to result in air entering the lungs. So this is just kind of showing you from a top-down view, from a superior view, what that looks like. So again, just a side view here, you can see your diaphragm moving down and your intercostal muscles moving the rib cage upward, expanding the interior of the inside of the lungs, creating a high volume, low pressure scenario, allowing gas to go from 1 atmosphere of pressure on the outside to less than 1 atmosphere on the inside naturally. Now, expiration. Expiration is going to be the opposite of what we just talked about. It's the relaxation of the diaphragm and the intercostal muscles. So when your diaphragm relaxes, it's going to go back up. And then when the intercostal muscles relax, they're going to pull inward, okay, which is going to decrease the volume inside the lungs. And you remember the relationship between volume and pressure. If volume decreases, pressure will increase. So now we have high pressure in the lungs because our volume decreased, and in comparison, our pressure outside the lungs is lower. Now, keep in mind, we are still at 1 atmosphere of pressure outside. That pressure outside has not changed. We're still at sea level. But in comparison, because the inside pressure is greater than 1 atmosphere, that puts the outside pressure less than 1 atmosphere, or I'm sorry, at 1 atmosphere. So we only are really talking about, again, another change of 1 millimeter of mercury. So the inside is now 761 millimeters of mercury, with the outside remaining at that 760. But the increase in pressure inside by 1 millimeter of mercury allows gas to move from an area of high pressure to low pressure, and air will leave the lungs. So again, just another view from a different angle, and then again, just another view from a different angle. So you've got, again, the intercostal muscles relaxing, the diaphragm relaxing, and that causes the internal area of the lungs to have less volume, more pressure. So I'm going to have you guys take a look at this on your own, and the key is right there, so you can just scan that QR code and get the key for these 3. So I'll let you take a look at that one on your own. Sorry, they're kind of all over the place there. And that concludes exercise 3.